A lot of people suffer from allergies. Dr. Mark Biagtan, an allergy and an immunology physician, explains three major types of allergies we can experience, and one of them only occurs during pregnancy.
So there are three major types of allergy symptoms that we can experience. One is environmental allergies, and that is the most common, where we have sensitivity to pollens, dust mites, pet molds, and that can include sneezing, stuffy nose, runny nose. And there is a very similar allergy-like condition called non-allergic or vasomotor rhinitis that people can experience. And it's a same presentation but different mechanism, where a change in our fight or flight response system, where we become more sensitive to irritants, that includes strong scents or chemical scents or weather shifts. And then there's a specific condition called pregnancy rhinitis, and that is thought to involve hormones, but has not been fully proven. But the thought is that there's increased blood flow to the nose to cause significant stuffiness.
Here are some recommendations to help with your environmental allergies.
During the bothersome season, keeping the windows closed or using air conditioning, and when you're drying your clothes, try not to hang them outside or the pollens can deposit there. For patients or people that have allergies to dust mites, getting dust mite mattress and pillow covers will really prevent the dust mites from entering the mattress, and that's where they like to hide.
Dr. Mark Biagtan also talks about several treatments to help with pregnancy rhinitis.
Keeping your bed a little bit inclined can help open the nasal passages more to make it more comfortable to sleep. Having breathe right strips can also help open up the nasal passages.
In addition, here are some medications that are safe to use during pregnancy and will help with your environmental allergies.
The most common ones we often use are oral antihistamines, so like the tablets we see. And so they help mainly with sneezing, itching, and runny nose. They're not as helpful for stuffy nose. So the ones that are most well studied in pregnancy are Zyrtec, which usually has a green label. The generic name is cetirizine. It works very well, except 10% of people can get drowsy from it, so you should monitor for that, but for 90% of people, you won't experience it. And then also Claritin is very well studied and safe to use in pregnancy, and that usually has a blue label. The generic name is loratadine. But they're not as helpful for stuffiness, so there is a nasal spray specifically for pregnancy, but can be used for anyone, but very well studied in pregnancy, called Nasocrom or Cromolyn. This is available over the counter as well as by prescription. But this is a nasal spray that works very quickly, within 15 minutes, to reduce nasal congestion, so you can use it as needed. But it's safe to use anytime that you're having the congestion. There's no concern about using it too much. And the drawback to this nasal spray is it only lasts for 4 hours. So if it wears off, you can repeat it, but if you're having symptoms all day long, it may be a little bit of a hassle to do. So the other very common nasal medication that is used in allergies, and including in pregnancy, are the local nasal steroid sprays. The most common one that we see is like Flonase or fluticasone nasal spray. That has been well studied to use in pregnancy. The one that's been most well studied is one called Rhinocort. The generic name is budesonide. And so that is also available over the counter. And the other nasal spray that is safe to use and well studied to use in pregnancy is called Nasonex. The generic name is mometasone, and that is available over the counter too.